The other thing you have to understand too is you're not really comparing apples to apples. To simply say I have $23,000 of coverage does not mean what it means today. Okay, you're going to have essentially, ostensibly, every single person in the country is going to be covered by insurance. Okay, so when you're sitting at home watching the ball game and you're doing great, you're going to say to yourself, I'm in good shape because I have insurance. But you need to understand something. Whenever you have a government-run healthcare system, you always see the cost of implementing healthcare skyrocket. If you have to pay out of pocket, okay, and you have a headache, you might say to yourself, you know what, I think I'll just wait a couple hours, take an aspirin, and see what happens. And for the vast majority of people, that'll take care of their headache. If you feel that you're covered by insurance and it's not going to be any cost to you, you're going to go to the emergency room and you're going to say, hey, I got a headache. You're going to tell the doctor, look, it's a headache, and you know what, it's the worst headache of my life. That's a phrase that's commonly associated with people that are about to stroke out. Now, a lot of people that say that aren't really having the greatest healthcare or headache of their life, but the doctor who's on call is not going to take that chance. And so he's going to order a CT scan. All of these things are going to drive up costs. Now, they had a wonderful piece in the Wall Street Journal several months ago that was talking about health savings accounts in Indiana. And essentially what they allowed to do was the state employees were able to use, I want to say it was $4,800 of their own money towards health care. Okay, 70% of people went on to the HSAs and only 3% of them switched back, which demonstrated that they liked it. Over the course of 2 years or 3 years, only 4% of people actually exceeded that $4,800 of their own money. They utilized doctor's office visits and emergency rooms 68% less often. They had half as many hospital admissions. And the Mercer Consulting Group, which looked into this study, basically also specifically looked to see that if the people in the HSAs were denying themselves either preventative care or necessary health care to keep those costs down, and they didn't. The other thing that was noted was they spent $18 less per prescription than people that were on the traditional health savings accounts. The state of Indiana decreased their state's expenditures by 11% solely with the implementation of HSAs. And the reason I'm bringing this up because it's fundamental to the whole concept of healthcare. When you give patients a relationship with the money that they're spending on healthcare, they make better decisions. Hey doc, didn't I have that colonoscopy last year? Do I really need another one? Or isn't there a generic drug that I could use that's just as effective? What you do is you see the cost of healthcare come down and you see patients able to maintain control of their own healthcare destiny, which is paramount in any healthcare system. When you start getting the government rationing your care, and it's gonna happen because you're gonna add a bureaucracy, people are going to start accessing the system frivolously, and you're going to have the government essentially start to run out of money, and they're going to be rationing from 20,000 feet. And that's a major
Let me make a point about what he's saying before we go. I want to make 2 points. First, in Indiana, it was $4,800. In the legislation, it's going to require reducing that. They don't want to encourage health savings accounts. They want to discourage health savings accounts, such that if you have accumulated $4,800 in your health savings account, you have put that money in and it won't be taxed. And then you are going to try and not use it and continue to build your medical emergency fund. That's what the doctor was saying. But in the legislation, over time, you won't be able to deduct $4,800. They're going to lower it to some other number, to try and phase out health savings accounts. They don't want people in charge of their health insurance. Secondly, let's go back to the $23,000, $28,000 example. The reason they want to start taxing health insurance coverage above a certain amount, they call it the Cadillac tax, is to discourage corporations from providing too much coverage to their employees. Let me tell you what corporations are going to do. They are going to limit the coverage that they provide to employees to not have to incur another tax. So it's discouraging corporations. The ultimate end game is for everybody to be on the government plan. And I've already heard CEOs say, if this thing goes through, which it has, and if it's fully implemented, because of the tax implications in terms of the Cadillac aspect, as well as because of the penalty they'd have to pay for anybody that works in their organization that doesn't have health insurance coverage. They said, well, we're just going to stop providing it and let people go on the government plan. Restaurant companies have the largest number of temporary workers. White Castle has already said that based upon the penalties built into the plan, it'll cut their profits in half. They are going to reduce their workforce. They're going to shut restaurants. They've already documented it, and that's just one example. So that constraint is designed such that long term, everybody is on the same government plan, and that's rationing controlled by the government.
Mr. Kane, if you may, real quick.
Go ahead.
We could probably talk for hours about this. We'll bore you guys to death. I'm a huge fan. We call this healthcare consumerism. I'm a huge fan of healthcare consumerism. I believe that's the best way to go about resolving the issues that are facing healthcare. Just in case you all aren't aware, what we're talking about is a high deductible healthcare policy. Basically saying, as a single person, family person, you have anywhere 1, 3, 5,000, whatever you want to set up as a deductible that you have to personally pay yourself to the physician, to the CT scanner, whatever it may be, out of your own pocket before the insurance coverage kicks in. Most of these plans have preventive care coverage so that you're allowed 2 preventive care visits annually for free of charge as part of that insurance plan. And then what you do is you have a health savings account as a side. So you've got your health insurance and then a health savings account. The health savings account is literally an account in a bank that you can put pre-tax dollars in, just like your employer can pay your health insurance in pre-tax dollars. Now you can pay pre-tax dollars into this interest-bearing account that you then have to pay out for until you hit that deductible, of $3,000, whatever it may be. And again, what they've shown in Indiana, 11% cost savings. Have we seen anybody talk about cost savings in this healthcare bill? Imagine if we saved 11% of our $2.4 trillion annual cost of healthcare. We're talking about $260 trillion. Now, granted, that's not going to be a number that we're going to come across, but that's creating a lot of efficiency in the system. What we're talking about here is trying to fix the crux of the system. Where is this good for? Young people, guys that are healthy, and there's ways to adjust this. But what you allow to do is that now you are starting to develop a fund in a tax-free, interest-bearing account that continues to grow over time if you start this when you're young, so that when you get to 50, 60, 70 years old, now you're talking about having a tremendous savings set aside to protect you against the disasters and big healthcare issues that can come about. What they found in Indiana is that this actually increased employees' costs. I mean, not costs, their salaries. Now these people are putting money aside that they would not have gotten, anyway, and now their wealth is actually growing. It puts you in control of your health care. If you do not use the $14,000 of your health insurance that your family costs, that money goes to the health insurance company. It doesn't go to you. Wouldn't it be nice to actually keep money in your own pocket if you don't have to utilize health care? Wouldn't that be nice instead of sending it to some big corporation out there? I think that would be more, I prefer that more for my family and myself. And so that's the idea, is it's putting you at the center front of actually making choices about your health care. And just to expand a little bit further about cost savings, and I'll stop real quickly, actuaries are the smart people out there that determine costs and risk and set insurance policies. There's an American Academy of Actuaries that actually looked at exactly these healthcare plans. And they found that in corporations that bring these about have a 12 to 20% cost savings the very first year they institute these. And those cost savings continue at about a 4 to 6% annual rate thereafter. Cost savings. Cost savings means more money. More money means more ability for us to maybe do some of the things that we need to do, like trying to make sure that we can expand some of the cost coverage, perhaps those within our population that don't have the ability to pay for health insurance. Perhaps then we can expand our health insurance coverage to the working poor that we really need to find a way to actually improve their ability to get health care. So just some positive things. We're talking about fixes here, but geez, isn't it nice to use some evidence and some data that actually shows that these fixes work, rather than just kind of throwing something against the wall that we know is going to cost us a tremendous amount of money?
The HR 3200 will reduce that 4800. We're just using that as an example. It will reduce it to discourage it. HR 3400 increases it to encourage it. That's the difference. That's one difference between the two plans. One other quick example. Steve Forbes of Forbes magazine back in the 1990s instituted a version of health savings accounts for his employees. And over a course of 5 years, in other words, he said, this is how much money I'm putting into your health insurance. I'm going to put it into an account even though I'm going to have to pay the imputed taxes on it because they didn't have the laws where you could buy it yourself. But he said, this is your money, it's in your account. Every year, I'm gonna put this much money into your account. If you don't use it, it's your money. The 5-year time period where he tracked it for all of the Forbes employees, the health insurance cost for Forbes employees that participated went up 0. The national average for healthcare insurance went up double digits.